welcome to worship tonight. Come on, put your hands together. Need another reason. I just need a chance to show my appreciation.
Hi, I'm Sandra Buchanan from Hudson, New York, on Ironsharpener radio show. I'm the show host. I welcome all my listeners and viewers to Iron Sharpener. What is Iron Sharpener about? Iron Sharpener is a platform that God has given me to bring businessmen, businesswomen, everyone who have gifts and talents. Why? Because we want to impact a generation that needs to be empowered. And we all have gifting and talents inside of us that we need to let the world know so that we could make a difference. And I truly believe that God gave everyone of us different gifting and talents so that we can grow and learn from one another so that the world can be better. We need one another, the body of Christ. So I welcome everyone, and I'm so excited to be here with a great guest of mine, Dr. Michael Peters, all the way from Ohio State. He is a physician, anesthesiologist, and we're here to hear and to be impacted and empowered about his career, how he started from where it was to where God has taken him now, and some of the wisdom that we need to learn about his profession before we go into surgery. So let's give a clap, hand clap for welcome Dr. Peters on Iron Sharpener. Hi, Dr. Peters. Are
Yeah,
you
hi
here?
Sandra.
You're here. Welcome. How are you today?
Very good. Thank you for having me on.
Good.
It's a
Well,
privilege to be here.
it is a great privilege to have you here. I'm excited to have you come on and share your gifting and your wisdom that we need to know about your career as a medical physician. So go ahead, sir, and tell us your story.
Well, just a little bit about my background. I've been a physician for 35 years, and I actually retired last year, but I practiced anesthesiology for 35 years and married and have three children and two daughters-in-law and one grandson. And so really, it's been a blessing and a privilege to serve the Lord in the capacity as a physician, because my heart has always been to help others, and physicians is one of the ways that individuals can do that, as they obviously people are in need and hurting or have health issues, and so that's our desire as physicians, to see that people that are going through sicknesses be made well. And so in my specific role as an anesthesiologist, uh, that involves putting people to sleep in the operating room, prior to surgery. There's many methods that we use, but what our main responsibilities, we see patients before surgery, then we are with them during the surgery, and then we are them
Okay, before
immediately
you get into
afterward.
that, I do have, sorry, let me ask you the questions so that you could go step by step so that the audience could understand. So, what type of doctor is an anesthesiologist and what do they do? You mentioned putting people to sleep.
Right. Specifically, when people go into the hospital to have a surgery, then an anesthesiologist would be the person that would be there during the surgery to make sure that they get through that surgery safely. So there are different types of anesthesia. Sometimes a person is not put out, most of the time they're put out completely, but there's other types of anesthesia where maybe, say if they have a surgery on their foot, just the bottom part of their body would be numb, okay? And there's different types of anesthesia procedures to do that. So
Okay, so
basically,
it
it is
depends on
putting
the
somebody's, preparing them
type
for
of the
surgery.
surgery. So general anesthesia is when you're put out
That is
100%,
correct.
right?
When somebody's completely asleep and they remember nothing about the surgery.
Okay, what type of training do they need for this and where did you get your training?
Well, I went to, obviously graduated from high school, then I went to college for 4 years. And then after that, I went to medical school for 4 years. I went to medical school at Creighton Medical School in Omaha, Nebraska. And then after that, I did a 3 year, what's called residency training. That's when you graduate medical school, you have kind of you're a doctor, but you're not specialized in any area. So I went into the specialty training of anesthesiology, and I trained for 3 years, and I did that at part of it at Ohio State University Hospital in Columbus, Ohio, and part of it in Louisville, Kentucky at the University of Louisville. And when I finished
So,
that,
what age were you when you got your board certification?
I was 31 years old.
That's
So
very impressive.
yeah.
Were you able to have a family then, or you were not involved in a
Well,
relationship?
no, I got married when I was 29. So I got married right when I finished my residency, and then through the board certification, you have to take a written test, and then a couple years later, I took it's an oral exam in front of a very it's kind of a grueling test, but that they examine you with orally, and then when you pass that, you become board certified. So I did that in 1991. So
Wow, so I welcome you. I congratulate you because you work very hard, and I would say your career is very important. So I really celebrate your career. It's an honor to hear your achievements. Can you explain to us what is the difference between a nurse, anesthetist, or an anesthesiologist? Because I know nurses, they enter this type of field to a certain level as well.
yeah, that's a great question. So there are obviously nurse anesthetists that provide anesthesia, and then there are doctor anesthesiologists provide anesthesia. The difference all has to do with the level of training. Okay, so a nurse anesthetist would get a nursing degree, like an RN degree. Then they would go usually about usually a year to 2 years or more, but mostly in that 1 to 3 year period, where then they'll get trained specifically in anesthesia. As I mentioned earlier, training as a physician is much longer and more extensive. But and throughout the United States, there's different places. I mean, there's some hospitals where there are just nurse anesthetists. There's some hospitals where they're just doctors, physician, anesthesiologists, and there's some where they work together as a team. And all those are good ways to do it. They're all excellent ways. It's just a matter of whatever the personal hospital preference is.
What are some of the experiences you have had in the operating room you recall?
Well, I'll tell you kind of a funny story. So when oftentimes people are anxious and a little nervous, and so I always kind of try to talk with them a little bit, and sometimes I even joke around a little bit. But anyway, this one particular man was a little bit anxious, and so as they're lying on the table, and you got to do certain things to get them ready, and then so he started to tell this story, and so but we had to kind of get going, and so I gave him the medication that puts him to sleep, and that works very rapidly in about a minute or two. But anyway, so he this is true. He literally started a story, okay, and then I gave him the medicine, so he basically finished half his story. But then when he woke up, he finished the rest of his story. So it was just that he didn't miss a beat. It was just kind of it was
That's
funny.
very interesting. How comes you remember where he left off?
Yeah, I don't know. Most of the time, people wouldn't do that because they're thinking 100 other things, and so and they don't. He didn't. One of the goals of anesthesia when you're in the operating room sleep is obviously you have no remembrance of your surgery. You obviously don't want to do that, and so he didn't remember anything like that. But
Okay, so I have a very important question. We know that anesthesia goes by dosages. So you have to know, I would say, mathematics, and you have to know your formula, and you have to know the body weight. Correct me if I'm wrong, but was this a challenge for you to know these, to study? Is that like chemistry or physics? What is it that you had to study for this part?
Yeah, it's a great question. Yeah, some of the main things in our training in anesthesia is physiology, basically a study of the different systems of the body, whether it be the heart or the lungs and various other things.
Anatomy.
But then also what's called pharmacology, where you know the different types of drugs and their effects on people. So those are two very, very big. We study many things, but those are two big things. And so, in answer to your question, we know based on body weight, and every person that comes to the operating room, they're always weighed, they always have a weight. So we base our dosages of medication and various anesthesia drugs not only on body weight, which is one, but the other big thing we base it on is what other diseases they have. In other words, there's a difference between an 80-year-old person who has really bad heart and lung disease as opposed to a 25-year-old young healthy person. So it's based on the medications given are based on the weight of the body, but also a bigger issue is what other medical diseases or health problems they have. So that's the main two factors.
So while they are medicated with the anesthesia drugs and they have the surgery or going through the process, do you have to stay close so in case they need more? Like, did you ever have a case like where they actually need more because the surgery got extended for some reason?
Yes, that so one part of anesthesia is, we never, the patient is never left, alone, okay? They're always, now sometimes, obviously, when cases are long, you might get a partner to come in and relieve you for a break, but there is always an anesthesia person, whether it's a nurse anesthetist or a doctor anesthesiologist, there's always someone continually with the patient in the operating room. And so, yes, and so there are many things that can happen during surgery, all kinds of things. And so, our goal, an anesthesiologist, is to kind of try to prevent problems, okay? And one of the ways is through, there's a very, very good technology which not only monitors people like their heart rate and their blood pressure, there's also a machine, it's called a pulse oximeter. Basically, it's just a little clip on your finger, and that measures your oxygen level in your blood. So these are all things that give us information and feedback about how the patient is doing. And so there's other things involved as well, but that and then communicating with the surgeon, and it's a team approach, okay? That in the operating room, the surgeon, there's nurses, and then the anesthesia provider. And so we work together as a team, good communication, and we're constantly watching the patient, make sure everything's okay. The big thing is we try to prevent problems before they might happen.
And after surgery, how long do they stay in the hospital?
Well, it depends on the type of surgery. In other words, there's most, majority of surgeries nowadays are what we call outpatient, where a patient would come you know, in the morning or early afternoon, and then they would go home that same day. But it depends on the complexity of the surgery. If you have say you're just having somebody look at your knee, what we call a knee arthroscopy, that's a procedure that you would come in and go out the same day, or some more simple type procedures. Now, if you have a big procedure, or maybe you have a big cancer surgery, maybe you have a big surgery to replace a hip or a knee, or any other type of like heart surgery, brain, those are all situations where many of them you require admission the day before, but often many of them, you'll be admitted to the hospital that morning, you'll have your surgery, but then you'll stay 1, 2, 3, 4, 5 days, depending on how extensive the surgery was. So,
Wow. There's a lot. This topic is very broad because it's so important what you do for surgery. What if the patient is allergic, allergic reaction? Is there different types of medication that you give for allergies when it comes to getting them sedated for surgery?
yes, that's a good question also. So when a patient is asleep, of course, they can't give you verbal feedback, so you have to look for other clues. And in terms of allergies to medication, there's certain clues. For example, each patient that goes to the operating room, they have what's called an IV, which is an intravenous solution that we can allows us to give fluids and also medications quickly. So you may put a medicine in the IV. You might see like what's called hives, which is swelling or rash around that time. That's one clue. Other times you got breathing problems. So these are all clues that help us determine something's going on. And then as far as treating that, a simple solution that we use in the operating room is like an over-the-counter where people know about Benadryl. It's like a anti-allergy type medicine. That's one. If something's really bad, we use a medicine like epinephrine, and if people are asthmatics and have other allergies, people are familiar with what's called an EpiPen, which is simply a product that an individual would take with them. If they're allergic to foods or various things, it's like something they keep with them all the time just in case something happens. So we have that type of medication available in the operating room if we see the need for it.
So I'm sure you have the respiratory therapist in the room as well, checking their breathing.
Yeah, that's correct. So it's just for patients that are listening, it's very important to have a good surgeon for your doctor, but it's also important to have a good anesthesiologist because when you are out, okay, and you undergo anesthesia, in essence, when you're put out, you're not breathing on your own, and so you're in the hands of an individual who is responsible for maintaining you during this, and so many times because you're not breathing, as a part of normal procedure during the operating room, you'd be placed on a machine or a respirator, which will actually breathe for you, and so that's a normal procedure, and it's a good thing. But yeah, keep in mind that this is the type of environment that you're in when you're under anesthesia. So it's important to have a good anesthesiologist with you as well.
But how do we can choose anesthesiologist when we sign up to do surgery? It's just
Yeah.
given by the physician that you choose, the team. Am I correct?
That is correct, but I mean, you can also I'll tell you a good inside clue. Talk to some of the nurses that work at the hospital. And being honest, I mean, the vast majority of them are very good because you will not last in that profession if you're not good. Okay, so it's not like there's, I mean, but still, yeah, that's a clue. Talk to the nurses because they'll know who's good. Okay, and or talk to
So
other
what
patients who have been in that hospital too. Those are two ways to
But
do it.
even if they don't recommend a person, you cannot say, I don't want that doctor. I need some. Can you do that as a patient? Can you really choose?
Well, the way to do that is if you know of good people, you can request a certain one. That's usually how
Okay.
it works. Yeah, many times in my practice, we had patients that would request either myself or one of my partners, and so we would honor that, in other words. And so that's a positive way to do it. You just if you know that, hey, a couple of these ones are good, it doesn't mean they're not. any of the other ones are bad, but you know that, hey, these are good, you can request, hey, I would like so and so to provide my anesthesia.
Oh wow, that's great. Amazing, amazing, great information for those who are just listening to Iron Sharpener Radio Show. Wow, we have Dr. Michael Peters all the way from Ohio. Is it Columbus, Ohio? You're from?
That's where I did my training, but we now live in Iowa. Yeah. The
Iowa, okay.
Iowa, yeah.
Iowa, and he's given us the wisdom, the knowledge about his career as a doctor, medical doctor, anesthesiologist, the precautions, what to do, what not to do, how to prepare. You have to prepare, do a pre-exam before surgery, and that's important. That's where you take all the medication, the allergies, and everything. Then you do a
Right.
post, right? So
Correct.
after surgery, you're in the recovery room. What do you do as a doctor for the patient?
Well, let me, if it's okay, you mentioned the pre. If I could just talk about briefly, then I'll talk about the post. So any patient, any individual that has surgery, they always most of the forms now are computerized. So when they are scheduled for surgery, they will fill out an anesthesia form. And some of the main things that an anesthesiologist will be looking for is number one, any health problems. Do you have any heart problems, lung, diabetes, anything like that? Okay, so that's number one. Number two, they want to know what medications you're on. Number three, they want to know allergies. And number four, they want to know if either you or someone in the family's had problems with the anesthesia. There's other things they want to know, but those are the main things. Okay, so they will have all that information ahead of time before surgery. So now, as far as afterwards, then once a patient comes to the recovery area, after surgery, our responsibility as an anesthesiologist would be to make sure that patient is stable, meaning their blood pressure is good, they're breathing okay, they're not having pain, different things like that. So we always stay with that patient. In other words, when they come to the recovery room, there's nurses then that we transfer care to that nurse. But we don't leave until we know that that patient is stable in all those areas I spoke about. And we want to make sure their pain is controlled, that they're not having, like I said, breathing problems or problems with blood pressure. So we want to make sure that they're in a safe place before we leave. And then, of course, we get called at times by the nurses for different, recommendations. But that's kind of how it works. So.
Were there ever a time where a patient is waking up out of surgery? They were out, sedation. They're being sedated, so they were out. And then they were woken up, but they could feel the pain, like they were still in surgery. It wore out. The medication wore out. They could feel the pain. And you guys are never aware of it. Was there ever a case like that?
So if you're talking about like somebody who was put out completely, and then as
Yeah.
you said that okay,
General. Mhm.
so that never happened to me, okay, and I mean by the grace of God, but I mean we were very that was part of my job. I was very conscientious taking care of my patients, and I've taken care of thousands of patients over my years. But yeah, to answer your question, that type of thing has happened, but you also have to understand it's extremely, extremely rare. Okay, and there are, I know, 60 Minutes and some of these other shows at times will or have a show out there that about something like that happens. The answer is it has happened. It's extremely, extremely rare. Okay, and actually, just being honest, when patients sometimes would ask me that question, and I would say, in all honesty, it's more dangerous for you to get in your car and drive than to work. The risk of that is far worse than this. So does that kind of answer the question?
Yes, it does. I do remember watching medical shows
Yeah,
and that happened and the way they
yeah,
set
yeah.
up the movie, it was scary.
Right. No, you're right. I mean, that's it should not happen though. I mean, it absolutely should not happen. So,
Right.
you know.
So, I mean, that was great. This was a great interview with all your professions. What led you to this profession? You were a medical student, you were in the university pre-med. Why did you venture off into this
I
as an
mean,
anesthesiologist?
why did I specifically go into anesthesia, or why did I want to be a doctor,
Specialize.
or both, or
Both. Two
okay.
questions, yeah.
Well, as far as being a doctor, my father was a physician, and then one of my older brothers was a physician, and it's kind of funny too. I even when I was like in second grade, when I was like, I was in a play, and they asked me to be the physician role in that, and I can remember even at that age having a desire, wanting to be a physician. So it's something I've wanted to do all my life, and so. But as far as specifically anesthesia, when you go through your 4 years of medical school, so it's before you move into your specialized training in whatever field you choose, you get exposed to many different of the specialties, whether it be surgical or medical or anesthesia or radiology or these different things. And I just really liked the idea of anesthesia because we have there's variety. There's multiple different types of surgeries, like orthopedic surgery. There's you know urology. There's brain surgery, heart surgery. So as you get to do multiple different things. Plus, I like working with my hands and with anesthesia. There's really really good modern technology where they use like ultrasound images, and so we do like pain blocks to help relieve pain. We use ultrasound. So there's a lot of different factors that was the thing that I was most interested in, and I was most fascinated with. So that's how I
Oh
moved
wow.
into it.
So you were born into it. Your
I
father
was born
was a
into it.
physician.
Yes, yes.
Wow. You can't escape that, right?
Yeah.
Wow. So what would you say to a student? First, I want you to tell me, you said you have a story you want to share. And then what would you say to someone listening to Iron Sharpener that's going into medicine? They have a passion for medicine, they have a desire for medicine, and they have a sense of fear. I want you to encourage the audience right now. Could be someone that don't have the finances and they're believing God to just make a way for them. They know this is what they want. It's inside that God placed this desire. What can you say to the person right now? Because you are young and you understand about fear pressure, you understand about maybe you never had to worry about finances because your family already prepared the way for you. But what can you say right now to encourage someone?
Well, I would say if you have a desire to be a physician, then that's really where it starts. And so, depending on your age group, whether depending on your age, I would highly recommend if if you haven't had much exposure to the medical field, there are many hospitals that will allow what they call job shadow, where you can come in for a day and and shadow a doctor. Okay, maybe in the operating room with the anesthesia or surgery or something. There are many of those. Most hospitals have some type of program like that where you can come in and do that. So that would be an excellent way to get exposure to it. But like I said, if you have a desire for it, I would say go for it. Okay, I would say a couple things with that. It does require a lot of work, okay, and a lot of perseverance, okay. even in college, in pre-medical studies, there was a lot of work. Okay, so getting into medical school is very competitive. Okay, and then and so you have to work hard and study hard. But when you get into medical school, then it's also a lot of hard work. Okay, and there's a lot of time and effort involved. So so not only is it important to have a desire to go into it, but if it's really necessary to have that desire and passion to really see yourself get through it. Okay, so there's a lot of work, a lot of hard work, but there's a lot of benefits and blessings when you graduate med school. Then you get trained in residency, and it's a very, very satisfying career, very fulfilling to be able to help people. Often many of them are in, like I said, they're sick or they're having some kind of medical issue, and if you can be part of that medical team to help them in that process, it's very, very fulfilling. And then also in terms of the financial aspect, there are many, many ways of getting scholarships and other programs that can help financially sponsor you if you desire to go to medical school. And then in residency, you actually get paid for residency, but in medical school, you have to pay for that as well as your college. So, are are we all finished?
Oh my God. Um, oh my God. I think I messed up my did you stop it or what? Somebody was knocking on my door.
Well,
Some you cut it out. Okay.
are you able to splice it or edit it? Okay. I was talking about I answered the question, and then I was talking about financially how there are programs and scholarships available for not only college but medical
Right.
school.
Okay. Okay. So I think Dr. Michael. Wait, Dr. Michaels. It's a pleasure having you on Iron Sharpener. To empower us with wisdom of your career as a medical physician. We are just so thankful, and I'm sure my listeners and my viewers are thankful for the knowledge and the insight that you have given unto us, because sometimes we don't really think about it. But it's so important, as you say, to have a good anesthesiologist that actually care for the patient, and have a passion for their work. You understand what I'm saying? Because if you don't, you're working under pressure and you're stressed and there's no passion, there's negligence will come in and mistakes and errors. So we are really thanking God that you had a passion for your work. You love what you did and you take it very seriously. I mean, you studied and you work hard to achieve what you have. So I just want to encourage all those as well who are going into this field, all the young students, that make sure the passion is there behind it, and loving people, because it's an, I think it's really an intimate work as well, because you're so close with the patient. Really have a heart for people. So I really want to thank you. And I think we're at the end of our interview. Again, let's give a round of applause to Dr. Michael Peters. We honor him for his work over so many years. And I just want to thank you for, it's an honor to have you in Iron Sharpener. So you will be back. And, we don't know what the topic will be yet. But I'm really happy that you're here, sir. Thank you so much. Did you share your story? You said you wanted to share a story of what God did for you.
Well, yeah, also thank you, Sandra, for having me on. I really enjoyed it. It's been a lot of fun. And I will share one story. There are many times where I felt God guide me and lead me in the operating room. And there are times that I would pray and ask Him for help. And there was one story many years ago where I was trying to start, it's called like an IV or a arterial line. Basically, it's a little tiny catheter in the artery in the wrist of a person. And this particular person was difficult to do that. They were overweight. There was a lot of other things. It was a very, very difficult procedure. So we were in the operating room. I was trying to do this, and I've been trying for probably 20, 25 minutes with no luck. And of course, everybody's anxious and nervous and various things. And so I finally just said, I didn't even say it out loud, but just under my breath, I said, God, I can't do this. I need your help. The very next time I went to do it, I literally felt a hand on my hand pushing that in right where it needed to go. And it went right in where it went. And there was no one else there. So God guided me. And I always give Him
You
all
did
the
it.
honor and glory for that.
Amen. That's a beautiful story. It's a very powerful story, and it really built my faith. Thank you
Yeah.
so much for sharing, and it's a great pleasure to have you in Iron Sharpener. Let's give a round of applause again for Dr. Michael Peters. Yay. Dr. Michael Peters, have a great afternoon, and you will hear from us again. God bless you, sir.
All right.
Goodbye.
Thank you. You too.